the distance education is just basically to roll everything out online. But I think as we'll hear, later in the presentation, it's a lot more sophisticated than just that. It's allowing schools to pivot and use hybrid and different models. They could even have students, in their dorm rooms taking classes that are being done in the classrooms right next door to them. Or they could be home doing certain classes and then come to campus for, say, a lab that's socially distanced. So that was one of the key ones. And then what we started to find out were these real specific areas that are tied to P12, such as student teaching, where, as you can imagine, our educator prep programs that have to get student teachers trained, they're having all kinds of issues now because of the restrictions, not only on our campuses, but also in our P12 environment. And so we had to come up with what are the guidance and flexibilities related to allowing for certain clinical experiences for student teaching. And then, of course, that kind of started to flow into our licensed professions. As you know, the state oversees over 50 licensed professions, unique compared to any other state out there. A long time ago, they decided when they were going to set up education in New York that under the umbrella of the regents and the state ed department, we're also going to have the licensed professions. And so, and I think Regent Collins is really going to speak on this a bit later as well, that, when it comes to nursing, we're hearing all kinds of issues, nursing, physical therapy, medicine, they're facing challenges too in the field. They've got to get people, to make sure that they're serving during this pandemic. And so we had to make sure that how are we dealing with certain alternative models? Do we have to do simulation? Because accreditation bodies require certain amounts of training at the bench, certain amount of hours of training with social work, mental health counseling. And so there's different scenarios now where we're trying to consider what still meets the standards to prepare somebody correctly for these professions and these careers, but also allows for us to get through this for this semester and the coming semester. So
let me go directly to someone who's really facing it hands-on day to day. President Smith, what is it that you're doing at your school to be able to meet those needs?
Thanks, Council Member Barron. So Berkeley College, like Monroe College and many other colleges, the presidents need to be very agile at this point. Columbia University announced on Friday that they're going entirely online. UNC switched from one to the other. So you need to be the ability to be able to switch back and forth and be able to do it fluidly, because the learning outcomes for any class, whether it's delivered online or on site, it's got to be exactly the same. And you want to have the same kind of outcomes, and students still deserve the same quality of education that's out there. So the approach that Berkeley College is taking is that about 2/3 of our classes in New York City are going to be online, and 1/3 of our classes are going to be hybrid, which will require our students to come into the class on campus about 1/4 of the amount of time of typical. But our syllabus are being built so that if we need to switch and flip out back to completely online, based upon state mandates, state guidelines, we'll have the ability to do that. Now, Berkeley's been in the online space for 20 years, so we're very, very comfortable as to how we do that. We have the technology, we have the tools, we have the training, we have the instructional designers to do that. So the flip for us, although it may have been challenging in some case for our students, we were ready and prepared and able to do it. And for many of our students, we find that when we track our persistence and graduation rates, students who take both online and on-site classes have the greatest persistence rate and graduation rate of anyone else in our system. So students are familiar with how to do that. But we are bringing students back on campus back in early September, and we're going to do the standard things. I've been on site a number of times. We have floor stickers. We're requiring every student to wear face masks. Teachers will have shields available for them to teach with. We have an app that everyone is self-certifying, because self-certifying their safety, their temperature, their exposure to COVID-19 individuals, whether they're traveling to any of the states that are quarantined at this point. All these things are putting in place to make sure that our students feel comfortable, and all importantly too, our faculty feel comfortable in what we're doing. We have sneeze guards in every imaginable direction. We're limiting classroom capacity. PPE on site, sanitizing wipes in every classroom, ultraviolets in the bathroom, self-sanitizing handles, and anything that you can conceivably do to make your site safe, we're doing. The one thing that's beyond our control, particularly for our New York City students, is public transportation. So, that is, beyond our control. We're very cognizant of it. But any Berkeley College student who wants to take a fully online program has the ability to do that. Students who feel the need to come on site have the ability to do that too. So that's really the approach that we're really taking. We feel comfortable, we feel good. We have the ability to be fluid, be able to switch back and forth should the need be required, and be able to meet our faculty's need as to their desires and their exposures, our students' needs and desires, and still focus on the learning outcomes and objectives that have to be non-negotiable no matter what the manner of delivery is.
And Noah O'Hara, we had also expected some comments from you on the status of the reopening, particularly as it relates to the technology that might be required.
Yeah, I've been talking to education executives, the COVID-19 councils at universities across the country about plans. And I've heard a variety of different things, you know, where they're asking the students to sign a code of conduct around how they're going to behave while they're on campus. I've heard, you know, some are going to do their own contact tracing. Some are going to rely on the local health departments to do contact tracing. Some are putting out apps. However, you know, what happened at UNC is a great example of what we're seeing when reality's happening. They didn't find anything that they could relay back to what happened in the classroom. They found 4 clusters of 130 students. They were in 2 dorm buildings, an apartment complex, and in a Greek fraternity house. So where the students got sick and where they exposed each other happened outside of the areas where you can control the education facility. So we've been really looking at how do we add additional technologies, not that you're going to prevent somebody from getting exposed, but how do you find those people as quick as possible and put them into quarantining and put them into a testing program before they go and continue to spread it across to other students and you end up having a shutdown. However, you know, one caveat, you know, my alma mater in Illinois had testing equipment on order and the health department diverted it to the hospital. So they ended up going entirely remote last week because they weren't able to do the testing on campus that they planned for. So we have to make sure that the schools get the right equipment to them from the health departments as well.
And I'm going to also now ask if Dr. Collins has comments that she wants to share, because certainly as a member of the State Education Department and that entity that's charged with receiving plans and reviewing plans, she might want to share some of her thoughts with us on that matter. Dr. Collins, if you're on mute, you may need to unmute.
I am. Okay. Yes, I've listened to both of the college presidents talk about some of the things that they're doing and working with their students who are coming back on campus. You can imagine how many of our students, and I've been a professor for a number of years until I retired about 3 years ago, and a dean and a chair of a nursing program, that the stressors that our students are bringing back with them, not only just afraid of the fact that they may contact this particular virus, but also those that have been bothersome for them while they have been quarantined in their homes. And I think that one thing that we have to do is to make sure that we distress them as much as we possibly can and work closely with our faculty so our faculty can talk to our students. One of the persons on earlier talked about wellness calls, calling students and making sure that they're okay and if they have any problems that they want to discuss. And with the budget cuts, I'm concerned that we don't cut those vital services that are needed, and that's in counseling and academic support services that we have and the nursing department that we have on campus, because that's where our students are going to probably turn to if they have any symptoms of a virus of any kind. And you know, we're working towards now the regular virus season, our season where we need to make sure and encourage our students to get their inoculations for our weather virus is coming, not the one that is already here. But we need to be able to support them. So we can't cut back on a lot of the funds that support our counselors, those who are going to help to de-stress our students, because if not, it's just going to carry over into their subjects and they're going to do poorly. So we need to make sure that we have those services. That's one of my very concerns, that we don't miss out on helping them so they don't turn to bad behavior. And that bad behavior can be in the form of alcohol and drugs and other things that they can get into when they're stressed out.
Thank you.
Okay.
The next topic generally that we said we would address was distance learning. So I'm going to address the question to the panel, and some of you will be able to respond. If we have extra time, we'll add others. So in terms of the distance learning, we know that online courses have been offered for some time, and we've heard presidents say that they have in fact been using it. And in the past, colleges and universities had to rapidly shift. And I just want to understand, what are some of the challenges that they face in terms of the staff, in terms of the equipment, in terms of adapting the material and the method of doing the pedagogical instruction. And just want to ask that again, what are some of the experiences, and particularly when we talk about students with disabilities, how they're going to be able to adapt with that. So I'm first going to ask Scott Reddy to share, and then I'm going to ask Mike and Noah, and we'll come again to the Chancellor, to the State Education Commissioner.
Thank you so much, Council Member. As you said, and as Bill also had mentioned previously, there's a lot of different methodologies that are being used in making this shift to a remote delivery. There's going fully online, there's hybrid, there's high flex. There's just a lot of different approaches, and many institutions are leaving it up to the individual instructors to determine how they want to deliver their courses. Mm-hmm. What this does for the students is really create a lot of challenges in knowing how to navigate what needs to be done in their courses and how they're able to conduct themselves, what's due, what the expectations are. It really becomes a challenge when there is a lot of inconsistencies. And then, as Councilmember, as you had mentioned, any students with varying abilities, this just exacerbates the challenge and creates a more stressful experience. Oftentimes, students who have developed a routine in being able to go to class, know what's expected, and know their pathway, now that pathway is completely changed. So for students with autism, for example, or auditory processing challenges, those challenges then, now when placed in remote learning and Zoom sessions, various challenges start to multiply themselves. As an accessibility evangelist, I encourage institutions to not only think about how am I making that transition with content to a remote delivery, but how am I ensuring that that content and our delivery methodology is not just meeting sound pedagogical standards, but also meeting standards so that all students have access. And captioning is just one example of how that provides access for more than just a deaf or hard of hearing student. It really provides engagement for all students. We all use captioning in various locations. And so when we start talking about universal design and improving that learning experience for all students, I just want to encourage institutions not to leave that to the afterthought of how we can bolt that on after we have already designed and started to deliver, but how can we be proactive in that approach?
I'd like to pick up on that discussion as well as in terms of distance learning. Because I spent more than 25, 30 years teaching in a blended programs at Empire State College. Was one of the first universities in the SUNY system that had distance learning. In fact, half of our students were online, and many of my students were online, and I had the ability to work with those students who were special students, special needs students, those with arthritis, those who had hearing, visual problems. And we had blended models then, and we continue to have them. Empire has really was the forerunner to all of what we have had to quickly divert to. They already had that as part of their delivery system. Distance learning is not something that is so difficult to implement when you have other models out there that you can borrow. I work right now as an adjunct at NAG University, and half of our doctoral students are online. And so it was easy for us to convert, but there are models out there that can be used quickly. And I am so pleased that I had that kind of experience for that many years to work with students at a distance. It doesn't scare me. You know, some faculty did not want to go online because they felt as though they were going to be losing that personal contact with students. However, you can do many things to keep that personal contact. So we at Empire State College, and I say we, but I'm not still there, but have really paved the way. And so our models are there, and I'm pretty sure that we have a lot of folks there be willing to share some of the different approaches to servicing our students with anyone who would want to learn.
Thank you.
Mhm.
President Michael Smith, would you like to share your particular experiences in terms of that at the university?
Absolutely, council member. So as I said, Berkeley's been in the online space for over 20 years at this point in time now. So we're very comfortable. We've been in leadership positions in the national organizations, the U.S. Distance Learning Organization and Quality Matters, which really has it out there. You know, a lot of institutions, you know, for many years were castigating and speaking ill of distance education and online learning.
Yes.
They thought it was an inferior form of education. It is not the same. It is significantly different than on-site education. And someone who is a wonderful on-site instructor does not necessarily translate to being a wonderful online instructor.
Yeah, you're right about that.
A learned skill. It needs to be trained. So, for example, for years we've had instructional designers. We've had teaching training specifically for instructors to learn how to teach online. Pedagogy is different and it's important, but the outcomes need to be exactly the same. You know, the learning objectives are the same whether the class is online or offline. Now, the advantage that an on-site teacher has is that there's a much greater ability to read the students and be able to read body language, see engagement. So in lieu of that, you need to measure engagement online in different manners. So for example, with the technology tools and the learning management system, one of the things that Berkeley does is we track very closely the level of engagement with our students with the learning management system. And we look at averages. We look at engagement versus averages. Students who are below averages gives us an opportunity to go out and put a touch or a poke on that student to make sure everything's okay. Many students go through their college education, went on site using their electronic device as their cell phone. And that's not a great learning device. Now, Berkeley's been using ebooks for many years, but many students would learn and read from their cell phones. You can do that periodically, but it's not a great way to learn. So to any student that needed a laptop, we provided a laptop. Any student that started in our spring semester, we provided a free laptop to. We're focused on outcomes. We want students to be engaged, and that's what's really, really important to us. The attention span of a student is short, so you need to be able to deliver in a way where you have the ability to capture the student's attention and keep them engaged in learning. And in an on-site classroom, you can do that. Online, it's a bit different because you've got a different dimension that you're working with there. And one of the key things is that I don't envy any institution that look to switch over very quickly, because again, we spent a lot of time doing this. We spent a lot of money on this, and it's the institution. The quality of an institution is really the quality of the instructor and the students. That's really in business, that's the product. But there's a lot of other supports that go behind it, and we feel fortunate because any student that would take a program online at Berkeley, our background supports, our supports for our students to succeed are the same for online, whether they're on site. So we have a lot of land-based support services, but every single one of them is duplicated online and has been, because we provide the same quality of education, and you need to, because that's an obligation. And for institutions that provide the same level of quality of education to students, those are the institutions that are not necessarily facing the discussion saying, oh, I'm getting my education online, I should be getting a discount in my tuition. If you're providing the same service in the same manner at the same quality, then the tuition rates remain the same. But for us, the importance and is really making sure that all the teachers that we switched over have the adequate training, support, that the students are availing themselves of all the online supports that are there, whether it's tutoring, whether it's personal counseling. And in the same breath too, as was mentioned by Scott, is that students do have different learning styles, and they also have learning disabilities. And we make sure that all the tools that we have in place for our students to succeed, and there's tons of tools that are out there, but they need to be specialized and customized because it's not one size fits all. We have our disability area that customizes the support, the accommodations for every single student to meet them exactly where they are.
Great. And finally, on this topic, we'll hear from Noel Hara. Been in your experiences in this regard, distance learning?
Yeah, and we've really been focused on the technology that it takes to have distance learning. Not, the experts have worked on the learning management systems and they're there. But, a great example, the state of North Carolina had a terrible day yesterday. We heard about UNC, but also when the Charlotte School District opened for their first day of learning, their entire system actually crashed because too many people hit it at the same time within the first couple of minutes of the day. So what we've been looking at are, the dorms might have fiber, so a student sitting in the dorm can go through a Zoom class and not have interruption. But the students that are at home learning in private homes or off-campus housing, they might not have the infrastructure. President Smith talked about making sure that every student had a laptop, but does the teacher have a device in order to engage the class, or are they using the little camera that we all have on our laptops? And do they have a microphone where they could be heard audibly, or are they just talking into what about a student that lives with roommates and doesn't have a private place to go for that Zoom class? Do they have an adequate headset? And most importantly, is there tech support? Is there somebody to call when you have a problem and you're not on campus? I've been following the social posts the last couple of days as schools have been starting. And one, it was something as simple as logging into a Zoom. It said, your meeting has not started. But this student thought that she couldn't get into her class and she was missing her first lecture and had absolutely nowhere to go except for posting something on Facebook on the university's wall. So we've been working, like I said, it's what we have for the enterprise, and for government agencies, they have a 800 number to call. They have an online chat to go to. Schools just don't have that in place right now when you're off campus to go and get help right now when you need it and get your education going.
And talking about getting help, we know that as we move to our next topic of mental health, that our students have been subjected to conditions and trauma situations and death in measure that none of us have experienced at our more advanced ages. Mm-hmm. And so we're wondering, what is it that colleges need to do? What kinds of additional supports need to be provided? And how are we going to make sure that students are aware that these opportunities and resources are available, particularly since they're not now in large measures on campus to stop at an office or to get that? So I'll ask Mark Jerome, and then I'll ask Scott Reddy and Dr. Collins to talk about the issue of mental health, particularly in the aspect that we've addressed. Mm-hmm. So we'll start with you, Mark Jerome.
Nothing could be more important. We all have to recognize how incredibly hard it is out there, especially in New York City and other hard-hit places. One of the first things I did that my wife wasn't necessarily thrilled with, but I'm really happy I did it, is I gave my cell phone out to all 7,000 students so that if they had a struggle or they were overcoming an obstacle, I would know about it and I could solve it. I have to tell you, the texts I got, the phone calls I got, not only brought tears to my eyes, but my entire family got to witness it. We had tremendous death, tremendous illness, tremendous stress. And so we all have to recognize anxiety, depression, whether serious or mild, feelings of being overwhelmed, and colleges are not known to be the most flexible, warm, easygoing places of all time. And that was probably my biggest job as president, was to assure we were flexible, we were empathetic, and we were just helping these students where they were and meeting them and making sure we did the right thing. And so I'll stop at that.
Okay. Dr. Cox, and then we'll also hear from Scott Reddy.
Yes, I'm unmuted, aren't I? Oh, yeah.
No, you're fine.
Okay. It's not only just the students we have to be concerned about in terms of de-stressing them. It's also the interaction of the faculty and others who work with them, is to make sure that they themselves are not stressed out.
That's true.
Because you mentioned that you gave your cell phone out to all your students. My cell phone has been on the front page of a newspaper because I want students to be able to contact me. But you have to put some limitations on myself too, and how much time I can devote to counseling. Being a nurse practitioner, counseling involves a lot because there's always the follow-up. And you don't want to promise someone that you're going to do something. You're going to call the Department of Social Services. You're going to call crisis service, or want to give them some information on terms of how to follow through themselves. But we also have to work with the faculty to make sure that they are de-stressed along with our students. And along with the students, because there are things that they can do to de-stress themselves. And it's the things that you can suggest as a faculty person, or you can have virtual relays. You can have virtual dance, because those are ways of de-stressing yourself, is to physically do something. So campuses can set up, an evening of dancing, but you're not dancing collectively, but you're dancing in your home. And this would be a certain time of the day. So we have to not only try to find creative ways, and certainly when you turn on certain music, that helps to de-stress yourself as well. So we have to learn how to help our students de-stress themselves and their families, because many of the techniques that we can use for them can be used for their family members, their husbands, wives, children, etc.
Thank you.
Mm-hmm.
And we're going to also hear from Scott Reddy.
Thank you, and excellent comments thus far. And one thing I want to emphasize here is that we have all experienced the kind of stress of not knowing how to navigate in different situations. Now with the new rules, the mask, which way do I go? How do I contact? What am I supposed to do? What's expected of me? How do I engage with people now that we all have new rules? And so it comes down to communication. Communication is critical. And like Mark did with handing out his cell phone number to everybody, he provided an avenue that students could contact. But that's one avenue. Every department on campus needs to be able to communicate and provide clear instructions. How do I process my financial aid? I have an issue here. How do I find out this information? I go to the website, but it's not clear. Who do I call? Who do I contact? All of those details create stress. And so now it's even more important, even more critical, that clear multiple channel communication takes place so that students can have that clear understanding. When you add these stressors and to a student that has varying abilities, then it just multiplies the scenario, the experience that student has. I love the point that Dr. Collins brought out about having extracurricular activities, various types of experiences for students outside of the classroom that helps them to bond, to connect with other students, with other faculty members, and helps to reduce that going to class stress that's already there, that's been multiplied by not having there's no autopilot that we can put on right now because everything is so different. And that just creates stress. And so by being able to provide those extracurricular activities that brings those students together, helps them to see that I'm not the only one, that there's others that can help me. and to help navigate this together, because you're not the only one experiencing this.
And you know that one of the things that's the hardest thing for us to do is not touch one another. So every now and hug, because there's some people that just love the hug, and I'm one of the huggers. So I'll send out a virtual hug to my son or to my daughter periodically. And I think, we can send out virtual hugs because there's all kinds out there. If you haven't received one, just send me an email. I'll send you a virtual hug.
Send us one. Okay. I'd like to call on Senator Stavisky to add some to this conversation.
It says I'm muted.
Yeah, no, you're not.
You're open. We hear you.
Am my mute still muted?
No, we hear you.
One sentence. The solution is not for CUNY to charge each student a $120 mental health fee, period.
Thank you. That's a very powerful sentence. We know that the state has traditionally, since the 1980s, not provided the funding that is needed. College education has been underfunded in terms of the contribution from the state. And it is ridiculous. For those of you who don't know, it's my position that we should return to CUNY being tuition free, and that we really need to do that. It's my position that at least the 2 years after secondary school should be provided either as college courses or trade school training free, because that's an obligation. There was one time when completing the 8th grade was sufficient. Now we're at a position where we know that just having secondary education is not sufficient. So I'm very much an advocate of at least the next 2 years after secondary school being provided free, and ultimately getting back to CUNY being free. That's one of my pushes. People who know me know that I'm always advocating for that, but it's something that's really very important to be able to provide the kind of opportunities and experiences so that our graduates will be able to participate in a meaningful way, which brings us then to our next question, talking about workforce development. So we know that we've got a situation where people are unemployed and waiting for government to be able to give them additional assistance. It's reduced, and we know that we've got to prepare a workforce that's going to be able to be functional in the days and weeks and months and years ahead. So we're going to talk now about workforce development. How are we going to make it meaningful? What are some of the opportunities that we have now in this situation to sort of do a different kind of assessment and help students understand what it is that's going to be appropriate? So we'll start first with Deputy Commissioner Bill Murphy, and we'll move on then to Dr. Collins and others that may want to join this part of the conversation, talking about workforce development.
Yes, thank you. And everybody knows that the history of our colleges in the workforce development and economic development issue, they're so embedded. From talk about our community colleges and how they're partners with the local hospitals and with the local companies, right up through our research and development at our universities. They've always been a key player when it comes to workforce development initiatives. And we saw this trend even before the pandemic,
yes,
where there were a lot of different programs that they wanted to make sure that when somebody comes out of college, whether it's a certificate or a bachelor's degree or a degree at the doctoral or master's level, we've already seen a trend toward making sure that students are coming out with something where they're going to be able to start really paying off those student loans and starting to participate in the workforce. And then there's major grants that have come through and initiatives where colleges have come to state ed and they've said, listen, we need to turn this around quickly. Times are a little bit different. We've got a new program that's going to address a new technology, whether it's in engineering or nanotechnology. And we have to be part of the partner solution for companies to make sure that this happens to create the jobs of the future. So there was this trend to begin with, and now we're going to start to look at what's going to be the trends for when we start to come out of the major disruptions that are happening with the pandemic. And I don't think anybody can predict, but I know that there's going to be, already you're going to start to see different funding projects, whether that's through the CARES Act, federal, whether you have state initiatives. And so it's going to be interesting to see. And then one last thing, and it kind of piggybacks off of our last topic. In higher ed, we have an Office of Access, Equity, and Community Engagement Services. And those are the students that are in a lot of our opportunity programs. And they're the students that are many times the most economically disadvantaged and underrepresented. And they are in our dual enrollment programs for high school, college, where they're trying to get started on a career and break into careers many times for the first time in their families. They're the first ones to go off to college and the first ones to try to break into a lot of these licensed professions. And there's been a lot of disruptions in these programs. And so it's, I know distance ed plays a good role in fixing some of these things, but this has been no panacea for trying to make sure that our most underrepresented students and students who want to access our very sophisticated labs on campus, it has not solved all those issues. So, it's going to be interesting. And I'd love to hear from Dr. Collins and some of the college presidents on, what their take is on that.
Okay, we'll move to Dr. Collins and then we'll move to others.
Well, one of my, and I'm hoping a wish of mine that would come true, is that every high school in the state of New York has an affiliation agreement with a community college where students can automatically take a course that would lead to some type of a CTE career, that when they leave high school and go directly into the college, when they leave that college, then they can go right to work and they can pay that tuition to go on for their bachelor's, because that's how I was able to take care of my educational needs, is that from a licensed practical nurse through a high school program, I was able to go on to become an RN, then a nurse practitioner, paying my tuition all the way through my doctorate. By having a CTE opportunity, that is what I would like to see our students have. It doesn't have to be a community college, but I'm a very supporter of community college because I spent many years there too as well. But I agree that we need to make sure that these students have access, and that's early on. We have to also look at the fact that we used a lot of health personnel during this virus. In fact, I think I saw somewhere where we brought in 300 health professionals to help us with our needs, our hospital needs, which means that, and I'm not sure if anyone's keeping a record, but they should be, of how many nurses were lost, how many physical therapists were lost, how many respiratory therapists was lost, and our health careers. I'm sure we have some deficits now. And so we should be focusing on trying to put monies into programs that will re-energize those careers. I have a list of careers from the Department of Labor where there was already a deficit in science teachers and nurse practitioners and physicians assistants and other health professionals. I hope somebody is keeping track of how many who passed away, because, they were the first frontline workers. And I'm sure we had deficits before we started in nursing. And now we have even more. And Commissioner Murphy knows that we have a tremendous need for mental health nurse practitioners, and also for our elderly geriatric nurse practitioners. So we should be taking a look at those careers where there is a deficit because of this virus and building programs for them and for our students. Thanks.
Thank you. Before I move on to perhaps the college presidents talking about their particular campuses, Dr. Collins, what are we doing as we're talking about nurses? What are we doing those nursing students who weren't able to get in their clinical hours because of the pandemic? What kind of provisions are being made so that we don't lose a whole crop of those who are interested in becoming nurses, but need to fulfill those requirements for clinical hours?
Well, we developed some regulations. Bill, would you mention them?
Yes. So in our guidance, what we've told colleges is that they can fill out, and if they come up with a plan where they need to supplement the hours with perhaps something that's simulated, they can file an application, and if it makes sense and it appears to be consistent with the accreditation standards. In addition, I think President Jerome had mentioned in a conversation I had that, a lot of times they'll even if a semester is starting to finish and they've got to extend, and I believe President Jerome mentioned they even brought their students back on campus, to make sure that they can finish out the remainder of their hours. I mean, we have to get, really creative here and to figure out how we were going to make sure that they get exposed to all of the different areas within the practice, whether it's pediatrics or, the emergency tech or, so we need to make sure that by the time they're done, that they do get exposure to all those areas. And we'll do our best to work with them, to say, look, what is it that we can do since you're facing challenges with your clinicals?
Right.
How can we work with you in that regard? So,
Because they have to practice those skills. They have to practice those skills, and some of the clinical nursing staff has told me that they have brought them in to locations, but few at a time.
Yeah.
Because you have to make sure that you can manage, 5 or 6 students, not 10 or 15 like we have on our clinicals.
Mm-hmm.
So this Monday, we had back our nursing students at 5 and 6 at a time for, we call it boot camps. The semester's over, but they're making up all the clinical work they missed during the semester.
Yes.
And I was very worried about it, but the camaraderie was excellent. The faculty's committed. As you know, nurses are a hardy, dedicated bunch.
Yes, we are.
That's your comments on CTE. We I think, educate about 2,000 high school students for college credit. And in the pandemic, it's not so easy. So I started having in-person breakfasts with high school principals to see how they want to handle that. Because they have A and B, and the DOE is having its challenges. So adding in the extra of college classes isn't easy, but we're trying to work it out.
And for Berkeley College, what we did is we have virtual simulation labs. So we were able in our programs in New Jersey, we were able to apply for a waiver. So at the end of June, we were actually able to bring students back in because students who couldn't graduate because they couldn't complete their labs brought back in. So we filed a 50-page plan with the state of New Jersey. We're approved to bring our students back in. We got them their clinical experience and are graduating the students because these students, these are licensed students, and it's one thing to put them through the quality education, but on the back end, there's licensure exams that are very serious. The NCLEX exams are difficult exams that students need to be very, very prepared for. We need to make sure that not only are they're getting their contact hours, but they're getting quality education. We also have Berkeley. We also invested in virtual simulations over the years, so we have the ability to flex through that also. So again, as I said earlier, institutions need to be very agile and be able to know that the normal that we're in now may be our normal, where we're going to bounce back and forth through this pandemic and the next pandemic, and be able to meet our students, because there are needs out there, as Dr. Collins said. We need to be able to train the workers of the future. And this is what our charge is, and we need to continually put not only people who go through the process, but with the requisite quality. We don't want students out there who are C students providing medications to us. Now, if you walked into a student, saw a student that didn't have the skills, you'd be scared, and you should be. So we're going to make sure.
Rightly so. Right. And now, as we're talking about wrapping up our program, we're coming a little bit towards the end, and we're talking about looking to the future. We know there's an expression, we're all in this together, and that sounds great, but it does not address the inequity that currently exists, and nor does it talk about a plan so that when we do come to the end of this, we don't all go back to where we were. So we're all in this together at this point, but some people are in this storm in luxury liners, others are in yachts, others are weathering the storm in rowboats, and others just have life jackets. So what are we going to do to make sure that as we go through this, and in fact, when we come to the end, we've been able to address much of the inequity, how we can put plans in place to make sure that people don't go back to the same ports that they departed from, but that there is some equitable attempts moving forward, that students in particular who have been largely underrepresented in our institutions and have had many challenges, how are we going to make sure that we're able to bring them to a place that's better than the place from which they left? Now, I'll ask any of you to jump right in.
Well, I think number one is that we have to learn from this experience. You know, it can't just be an experience. We have to learn from this experience. And we know one of the major things is we were not prepared. And so we have to look at that laundry list of why we were not prepared. And there was some information that was given out last night in the convention about the fact that there was some indications that there was going to be a virus that was going to be out there. And we ignored it. But we can't ignore this now, because if there is a resurgence, like some people are saying, we have to be prepared, and we have to bring everyone together to help this nation. Not just some that are privileged to have the opportunity to have had some training, but think about those who have not had the training and how we can pull them into a classroom, be it a virtual classroom, a classroom in a church, utilizing resources and other locations to train people. Because there are a lot of training facilities out there, using urban leagues, using Girl Scouts and Boy Scouts facilities. We've got to be able to find those locations, but also put together these quick, short curriculums. So if we have to do this again, we do have something. Someone should be keeping a record. And I said this at one of our meetings, Commissioner Murphy, that we need to have an inventory of all the things that went wrong, and then start building a list of what we did to correct them. And I think this should be each institution, how they were not prepared. That's my suggestion.
Mike, I couldn't.
Toby, yes?
Yeah, I couldn't agree more, but I think, quite frankly, we've known about this. Many of these problems go back pre-pandemic, and we have turned to Washington on so many occasions. And with all due respect, the state of New York shouldn't be the watchdog or the laboratory for the rest of the country. We have to be more prepared in terms of anticipating the future, but many of these problems go back before the pandemic. And I couldn't agree more with but we also have to decide the direction that we're going and what our future holds for us, because those who don't learn the history are doomed to repeat it.
Yes.
Well, we're running out of time, but we also wanted to just be mindful of the fact that there are all what we call ancillary services, which campuses are mindful of in terms of their students' needs, be they food pantries and the opportunity for the euphemistic phrase that they like. They never say hungry, food insecure, but we know that it's hunger. So we just want to make mention of the fact that we're aware of that, as well as the need for childcare services for students that need childcare services. And that's an important support for them so that they can, in fact, be able to attend their classes. But I think I'm getting a note that our time is just about expired. But if there's anyone who has a 60-second closing or burning comment that they want to make,
Yes.
I want to give you an opportunity to hop right in and do that.
I'd
Real
like to
quick.
say thank you to you.
Thank you. You're welcome. I'm glad that you were able to join us.
Councilwoman, you mentioned the food insecurity and the child care, and to their credit, both CUNY and SUNY have addressed this issue to some extent. You have the Chancellor's Fund, you have daycare, you have something like 48 daycare centers at SUNY out of the 64 campuses, and about 15 or 16 at CUNY. They need more. Those programs can't be cut either.
Any of the other panelists want to have closing comment? Well, I want to thank you all. It's been a pleasure meeting some of you for the first time, and thank you for your participation. And I'm going to turn it now to John, who has indicated in the chat that our time is just about up. And if there's anything further, I'll be glad to present.
No, very much appreciated, Council Member. Thank you for moderating this session. I think that concludes this panel. We'll now bring up our last panel as they come up. Again, thank you to all of our panelists. Fascinating discussion.
Thank you.
And yeah, if you're on our last panel, go ahead and bring up your video, unmute yourselves. We'll get started momentarily. This last panel is Reimagining School in the Ongoing New Normal. One of our panelists, Barty Jane from Columbia University, had to cancel due to a conflict last minute. So I believe there will be two panelists along as with our moderator. One final note, this question has come up a little bit in the chat. Yes, we are recording this discussion. We will send it out. It will also be posted on our event page. So if you missed anything, if you need to tune out, you want to catch up with something later, you can do so. Now, without further ado, I'll turn it over to Jake Brown, AVP for State, Local Government and Education at Qualtrics. Jake, over to you.
Thanks, John. Hello, everybody. Welcome. I have the honor of hosting two of our partners today from the City of New York, in Johann Starr and Dan Dickerson from NYU School of Law and Weill Cornell Medical, respectively. We've been working with both these institutions for a long time, and yet the challenges that they've faced and that we've tried to lean in on have obviously been distinctly different over the last 6 months. And so we'd like to start out by just hearing a little bit about who they are and what they do in their normal lives and what they've been tasked to do over the last 6 months, and learning a lot about what they've needed to do to adapt, to listen and learn and understand how experiences of their faculty, their students, and their community participants have changed over the time, and what they've needed to do to ensure that teaching and learning can continue. So Johann, if you don't mind, let's start with you. Do you want to give us an overview of who you are and what you do during normal times and what you've been doing now?
Sure. So I'm the lead instructional technologist at the School of Law at New York University. And in the pre-COVID world, a long time ago, I was really helping facilitate technology from a teaching perspective. How does technology support good teaching pedagogy? How do we make sure that faculty are properly supported in and outside the classroom, and providing the best learning experience for the students? Obviously, that's changed a little, but now it seems my role has expanded, especially now that the university is in a remote modality. It's getting not only the learning environment situated and managed, but it's also helping support all our remote working efforts as well.
Yeah, thank you. You've talked a lot about the shift that you had to make, not only as this hit in the spring, but getting ready for fall, right? So there was obviously a lot of change that just had to be emergency triage then. Can you talk a little bit about some of the listening you had to do as there was this big shift as the pandemic kind of began to make an impact on the way in which teaching and learning was being conducted at NYU?
Absolutely. So I'm sure all my higher education colleagues can concur. We had, a week or two at most when we were given the word that we would be switching to fully remote. So that was the first shock that came to the system. And it was really scrambling around to make sure that everyone was prepared to leave campus, had at least in hand the hardware, the processes to be able to connect remotely. So really a triage environment, as you mentioned, in terms of getting or switching in the spring term to a fully remote model. Based on that, though, it was great to see that, for the most part, it was a success. People understood, obviously, some of the challenges. Students understood, faculty understood, and the staff and admins were there to support. But it was really critical that time that we were switching, that we captured, as you mentioned, some of the critical data points. So we knew, we might say post-mortem, was a success, and what was success? What are the metrics for success, and how do we gather meaningful data so that as we moved into the summer, where thankfully the number of classes reduced and it gave us some breathing room to reflect and refine our policies and procedures, and make sure that this upcoming fall term, we were prepared to not only satisfy the experience that we had already gone through, but try to assemble some type of hybrid return, which is difficult. And without having data to base those policy and those decisions on, and understand where we came from, it's like walking blind. You're in the dark there. So it was critical for us to be able to survey faculty, staff, and students. Yeah. What happened? Where are they? And where do they want to be? Right.
Yeah, good point. Thanks, Johan. I want to have Dan, if you don't mind, introduce yourself as well. A lot of our conversation was in the same vein, so I'd love to hear who you are and what you've traditionally done at Waukon Medical and what you're doing now, and then maybe dovetail that into this conversation as well.
Sure. So I'm Dan Dickinson. I'm the Associate Director for IT Experience at Cornell's Medical School. We're down in the city, not upstate, although I've got roots there. My usual responsibilities in this role are to make sure that our technology initiatives are really meeting the needs of our 8,000 plus faculty, staff, and students. As a medical school, we have a big footprint in clinical care. We have a lot of ongoing biomedical research and lots of different specialty education programs, both in our graduate school and for undergraduate medical education. So during COVID, because my role sort of umbrellas pretty nicely over the IT organization in some ways, I organized a lot of our technology response and just tried to coordinate it because it's a lot going on in one shot. And also ended up getting pretty heavily involved in our institutional communications around COVID internally, which we'll dive into in a little bit. And certainly, our challenges are very similar to what Johan just described. We had a large number of faculty and staff who had never once considered working remotely. And the clock was ticking, I want to say March 1st, where this became a struggle of what is this going to mean? How are we going to get all these people into a remote work arrangement quickly and successfully, which when the stress is high and when it is the sort of crisis that medical colleges are here to help address, it was a very unique challenge for us to dig into. I think the difference from what I heard Johan mention is we really never got the chance to stop because the patients were coming rapidly and needed to be cared for. The educational programs had to swing to remote learning almost immediately, and a lot of our research was being ramped down so that we could reduce our footprint on campus. But at the same time, we have new research activities ramping up from faculty who want to study COVID data and to try and make a mark on fighting this disease. So I don't know that I've felt that we've gotten a pause at any point during this yet, but I'm hoping for one. So.
Yeah, well, with fall semester beginning and the continuation of the incredibly disruptive challenges that are being presented by the pandemic, you have my hopes as well that things calm down and you can get back to what we consider to be the new normal, as we've talked about lately. It's that disruption, Dan. It is just how massively every aspect of education